Welcome, everyone. We'll wait one more minute while the attendees populate the conference. Okay. All right. Well, good morning, everyone. My name is Stephanie Lanza. I'm the director of the Consortium to Combat Substance Abuse, and we are very, very pleased to have convened a wonderful shortened conference day virtually today and gather all of us together. I have very brief opening remarks just to orient all of us to the day, and then we'll get moving right away. So to begin, I'm going to share my screen for just a moment. And okay, so again, welcome. So the title of today's conference, what we're all here to talk about today, is Addressing Substance Use, Cross-System Solutions. So I want to welcome all of you for coming. And just as a reminder or some background, the consortium, the CCSA, was established in 2018 as part of Penn State's institutional commitment to enhancing health. The overarching goals of the CCSA are to connect and grow a diverse group of researchers and educators who, in connection with prevention and treatment providers, policymakers, funders, and other stakeholders, work toward addressing the systemic problems of substance use. So one of the key initiatives in our first 3 years of existence has been to expand the consortium. And we've done that with the university's strong support. And our initial efforts here are to fill 12 new faculty positions all across the university. So we're increasing our capacity for research and partnerships. And so I'm just giving you a little snapshot here of folks that we've hired. There are 10 people with pictures and names who either are here or are joining this summer, and 2 searches that are in progress in ag economics and health policy and addiction studies at Abington campus. So welcome to our newest substance use researchers who are joining Penn State, and we look forward to really partnering with them as we go forward. Just a couple of announcements about the consortium at large. I wanted to just comment on 2 things, and I'm happy to take questions after over email and discuss any of this. But I wanted to share with everyone that after 3 years of careful consideration, we have decided to change the name of the consortium. So as easy as CCSA now flows off of our tongues, we're going to change the acronym because we wanted to rename the consortium in a way that was very carefully appropriate and not in any way stigmatizing. And so we consulted with a number of researchers, policymakers, funders, and people with lived experience. And at the end of the day, we decided the best name that will hopefully last in perpetuity now is the Consortium on Substance Use and Addiction, CSUA. So stay tuned for that this summer. You'll see a rebranding slightly. CSUA will be the consortium going forward. And along those same lines, it's shocking to me to realize this, but I'm finishing my 3-year term as the director of this CSUA, about to be CSUA. And so my directorship is rotating to an end. And I'd like to announce our next director, Dr. Paul Griffin, who's a professor in industrial and manufacturing engineering at Penn State. Not coincidentally, he has a strong focus on systems and how systems operate. And so I think this is going to be a really exciting 3-year rotation for Paul. So you'll get to meet him at the end of today. So the conference at a glance, we're going to cover 4 systems. It's all going to move rather quickly. Each system that we're going to touch on: education, faith-based communities, the correctional systems, and the healthcare systems. We have convened an expert panel, a diverse panel, to take questions and answers. There will be very few PowerPoint slides today. So participate in the discussion, and then there will be a closing session titled "It Takes a Village." We're happy to have David Saunders, the director of the Office of Health Equity and the PA Department of Health, join us to make some closing remarks this afternoon. So please participate today. You can browse the participant list and see who all is on at any given moment. Your chat function is not enabled, but we encourage you strongly to use the Q&A function today. Anytime today, at any point, post a question to panelists that you've got. We'll try to get to as many of them as we can. You can upvote questions that are of particular interest to you. And if we don't get to them today, we're saving your Q&As and we'll still try to respond with answers in the future. And finally, after the conference, we'll be sharing a full participant list so that you can get in touch with anyone that's here today, should you wish to follow up. And we'll get a brief survey about this conference, but in particular, seeding ideas for the next annual conference of the consortium. With that, I just want to thank you all for being here. In particular, thank you to the university administration for prioritizing these issues of substance use and addiction. Many thanks to Dr. Susan McHale, the director of the Social Science Research Institute, who really helped stand up this consortium from the beginning. We couldn't have done it without her. And the CCSA Executive Committee and Advisory Board. And finally, my great thanks to Jennifer and Stephen, who joined me to form the conference planning committee this year, and their help was just incredibly valuable. So with that, I'm going to unshare my screen. And I would like to welcome Penn State University President, Dr. Eric Barron. He just wants to welcome us. Thank you, Dr. Barron, for being here.
Well, it's my pleasure, and thank you for the invitation. I want to echo Stephanie's sincere welcome to Penn State's annual conference on the Consortium to Combat Substance Use. It's been a long and difficult year for all of us, but we are resilient and we are going to persevere. I look forward to next year when we can meet again in person, but I'm pleased to work to address the critical issues related to substance use and addiction is carrying through this virtual conference. This consortium is integral to Penn State's land-grant mission, which is to serve the citizens of the Commonwealth and the nation. The consortium is also a foundational part of our university's enduring strategic priority of enhancing health. We recognize that as a leading research institution and the land grant of the Commonwealth of Pennsylvania, Penn State has the capacity and the responsibility to take on complex issues of problematic substance use that have significant impact on the lives of individuals and their families and their communities. When we established the consortium in 2018, we could not have imagined that what the world would have in store for all of us in the coming years. In these incredibly challenging times of a global pandemic, issues related to substance use and addiction loom larger than ever before, and disparities that have long existed continue to deepen as the impact of the pandemic is disproportionately felt by certain populations, including individuals who identify as persons of color. This means that we must continue to take strong and decisive action and be persistent in our efforts to address problematic substance use in its many forms and at all stages, from prevention to treatment to recovery support. One of the greatest impacts that Penn State can have as an institution of higher education is to invest in growing capacity to conduct innovative, high-impact research. This will make a difference in the world around us and prepare future generations of students to have a positive impact on the issues of substance use through their careers. I'm very proud to say, under this consortium, Penn State has hired a diverse and energetic group of new faculty members. They were selected based on their commitment to work together to solve complex problems of substance use through interdisciplinary research, their desire to educate the next generation, and their drive to make a difference. In addition to attracting talented scholars to Penn State, stimulating new interdisciplinary research projects to tackle the major issues of substance use and addiction, and investing in university community partnerships, this consortium has another mission. That mission is to bring together the many critical stakeholders who share our goal to address these complex issues. Although Penn State has many devoted researchers and educators, we know that we cannot have a large impact on the lives of individuals, families, and communities unless we partner with many others. We're here to do just that today. Participating in today's panel discussions are researchers from other institutions around the nation, key policymakers and government officials, leaders from philanthropic foundations and nonprofit institutions, prevention program specialists, treatment providers, faith leaders, individuals working in the criminal justice system, school administrators, and more. I'd like to highlight just a few of today's distinguished speakers. This morning's first session, focused on educational systems, will include Dr. Paul Kasmarsik. He is a former school administrator who has sustained a long partnership with Penn State to provide evidence-based substance use prevention programs to students in his school district. Later this morning, Mr. Christian Thrasher from the Clinton Foundation will convene a panel of 3 faith leaders who will share diverse perspectives on their work addressing systemic problems of substance use. This afternoon, in a session focused on correctional responses to the opioid crisis, features Mr. Jared Lutz, a certified recovery specialist. He's an advocate for previously incarcerated individuals who are recovering from substance use disorders. In the last session this afternoon, you'll hear from Dr. Linda Thomas Hemmock, a leader of a nonprofit community healthcare organization focused on addressing the nation's primary care physician shortage and related health disparities. I'm also pleased that Mr. David Saunders, the director of the Office of Health Equity at the Pennsylvania Department of Health, will speak during today's closing session. These are just a few examples of the critical, diverse group that the consortium has gathered today. Solving issues related to substance use and addiction is arguably more challenging and more important than ever. Thank you for your commitment to join this important discussion today, and we hope that you will continue to engage in this growing community. I look forward to hearing more about your work and the outcomes of collaborations and knowledge gained today. Thank you all for joining us, and I hope you have an absolutely great meeting. Thank you.